All right, so we're on, right?
Yep.
Perfect. All right, good evening and thank you for joining tonight's reopening town hall hosted by Manhattan Borough President Gail Brewer and Community Boards 9, 10, 11, and 12. My name is April Adams. I'm the Manhattan Borough President's Community Liaison for West Harlem and the Upper West Side, and I'll be the main moderator for today's town hall. Tonight, we aim to answer your questions about reopening New York City, questions addressing healthcare disparities, the operation of parks and other public spaces, housing concerns, and to provide guidance on the reopening of businesses. And before we begin, a few housekeeping notes. If you have any questions, please use the Q&A box and we'll try to have the agencies answer as many questions as possible during the Q&A sessions. Also, please check the chat box periodically as some agencies will be using the chat feature to share resources. Lastly, tonight's town hall is being live streamed on the Borough President's Facebook page and will also upload a recording on the Borough President's YouTube channel. Without further ado, let's get tonight's town hall started and please welcome Manhattan Borough President Gail Brewer to your screens.
Thank you very much, April. And I want to thank from the bottom of my heart all of the Uptown community boards. I heard something today which I love sharing. I don't know if it's true, but I love sharing anyway, which is that my understanding is that you rock so much as a community board in Manhattan, all of you, but particularly Uptown, that when we're trying to do ULURP to get it started so that we can actually do some good things, although ULURP can also be challenging, the reason it's slowed down is because the other boards can't keep up with you. So I just want to congratulate you on all that you've been doing. The agencies don't have to listen to this, but that's true about the Manhattan board. So congratulations. And I just, I'm not going to go through all the names, but between Barry and Yutha and Cicely and Shatik and Nilsa and Angel and Elzar and Ebenezer, and from our office, you heard from April Adams, Athena Moore, Rosie Mendez, Isabel Abreu, and Natalie Espino. I thank everybody. These are tough times. So just today, we were down actually in board 1, but we'll be in board 12 soon, talking about the restaurants and the hair salons and trying to figure out how these businesses can make it. Obviously, we put health first, and I know we'll hear from the wonderful people from the Department of Health about the testing and the tracing, and I heard a little bit from Dr. Long today and people from the health department about how they're managing. I think that in terms of the summer, which is where we're at now, we obviously have, phase 2, phase 3, but I am swamped as you are with young people who want to participate in sports and summer camps and figuring out how to deal with the Parks Department and how do we obviously fund some of this. So it's going to be a rough summer. We have all the health concerns that we've been dealing with, and I think that testing and tracing has helped a bit, but people are still understandably nervous. We have the seniors, and we have the all of the wonderful protests that are taking place. I know that in Harlem, as well as downtown on July 1st through July 4th, there's going to be painting of Black Lives Matter in Harlem and near the African burial ground downtown. So that's all taking place. I want to just give a shout out to the arts. I know Boza Rivers is listening in, and all of the community boards have participated with Athena Moore on making sure that these amazing arts organizations have a voice, sharing with each other. And I think we should be very proud because the arts organizations feel that somebody is listening. And that's the same thing that young people say when they protest, somebody's listening. And there's nothing more challenging than trying to get your message across to government. And that's hopefully what the community boards are there for and what we are there for. So there's a pandemic on all fronts that we're trying to deal with. And you as the frontline essential workers in terms of community input, I just want to say congratulations. And I definitely thank all of the agencies who've taken time. I know how many Zooms you've been on yesterday, the day before, today, and that this new normal, which we're glad it's not the old normal, but we're not clear what the new normal is. We want to make sure that the Uptown, Northern Manhattan communities are prioritized and that they get all of the services they need. I do hope that as time goes on, this is my wish, that we think of healthcare disparities stop. We've got to figure that out. Same thing with the issue of people getting jobs and also the issue of small business. We have the housing concerns, but those issues have to be addressed in a different kind of way. And I hope that we have a further conversation, particularly starting with the health, as to how do we work on fresh fruits and vegetables, primary care, health centers open more often, and all the things that people who are more expert than I am in that field can in fact use this god-awful experience as an example of how to do it differently. Now, I'm not going to eat all the vegetables that Eric Adams eats, I must admit, but I do want to find a way for us to be healthier. April, thank you very much, and I look forward to the presentations.
Great. Thank you so much, Borough President. Now we'll hear from two incredible hardworking Borough President staff members, Athena Moore, Director of the Northern Manhattan Office, and Rosie Mendez, Director of Community Affairs. Athena or Rosie?
Thank you. Athena here, Director of the Office. And just to join our president and my colleagues
I can't.
Athena, I think there might be some issues with your audio or with the internet.
Maybe go to Rosie and come back.
Yeah, let's do that.
Rosie, go ahead.
Hi, I just want to welcome everyone. As was said before, these are challenging times, and I've been really impressed by the resiliency of all of the community board chairs and district managers and how they've quickly have gone to working with and for the public during this time, and wanted to thank those who are here today from boards 9, 10, 11, and 12 for all that you have done and for making yourselves available today. Thank you.
Great, thank you, Rosie. Athena? Let's see if she's able to hop back on. Looks like not.
And then just go come back later.
No problem, we'll do that. Thank you. Okay, so now I'll introduce our first presentation tonight. Here to speak on the city's plans to address healthcare disparities in communities of color and health safety as we continue to reopen is Dr. Noel Menyenda of the Harlem Health Action Center, followed by Dr. Theodore Long with Health and Hospitals.
Hi, good evening, everyone. Thank you so much for having us here to contribute to this conversation, this important conversation. Also, just want to reiterate, as a Harlem resident and as a person who works here, the same praises about the community boards in the area, both in East Harlem, West Harlem, Central Harlem. You guys have really been showing up and you've been strong in the community. So thank you for that. In my work now, I'm also Assistant Commissioner for covering Brooklyn and the Bronx, and some of the other neighborhood responses that we're doing citywide as regards to COVID. And so, there's a whole perspective there, but I'm always rooted in Upper Manhattan, so I'm grateful for this opportunity. I just want to start off by saying that.
No, talk up a little bit more. Can you talk up? Yeah.
Sure.
A little bit louder.
Okay. Hear me? Is this better? Is this better?
Yes, yes.
Great. Yeah, no, so I just wanted to start by saying that I think we're all aware that Black and brown people have been proportionately affected in terms of both affecting this disease and also dying from this. The rates are about twice the rates for white and Asian New Yorkers as it is for Black and brown New Yorkers, Black and Latino New Yorkers. And so we know that, we also know that in the mix of all of this, Black and brown people have also been disproportionately affected by the unemployment that has come out of this whole crisis. We also know that folks have had to live through the trauma of seeing police-involved shootings and murders and all that kind of thing across the city, across the country, even in the city. This has added to the total, the full scope of trauma that people have been dealing with And yet people are resilient, people are strong, and people will make it through this. We will come through this. Just wanted to say that if you looked at the numbers, there have been about 5,300, 5,400 cases among Latinos. There have been about 48 to 4,900 cases among Blacks. There have been about 4,300 cases among whites and about 12 to 1,300 cases among Asians. These are the total number of cases. And we could say that also but the rates among just both in terms of the cases and in terms of the deaths have been significantly higher for Blacks and Latinos. Just by borough, the Bronx has had about 47,000 cases. Let me make sure I get these numbers right. About 26% of which were hospitalized. Brooklyn had about 58,000 cases, about 26% also hospitalized. Manhattan has had 2,600 and about 31% hospitalized. Now we know when you see those numbers from Manhattan appearing lower, if you take Upper Manhattan alone, a lot of the cases are actually concentrated all the way from East Harlem through to Washington and Inwood, Washington Heights and Inwood, and everywhere in between. And so the rates in Upper Manhattan are actually higher than obviously the rest of Manhattan. Queens has had about 64,000 cases, and about 26% of them have ended up hospitalized, and Staten Island has had the fewest, about 13,000, and about 17% hospitalized. As we all know, New York has entered into phase 2 of reopening, and that means that there's a broader spectrum of businesses and other economic activities happening, including offices, real estate, barbershops, salons, outdoor and takeout food delivery services, and some of you may have already seen that in terms of delivery straight to your door and things like that. But we're still, from the health department, we're still emphasizing the messaging around about all New Yorkers need to get tested. There are a lot of community sites now that a person can receive testing. If you visit the nyc.gov/COVID-19 website, you can find information on where to get tested near where you live or work or whatever is more convenient for you. We're also encouraging ongoing physical distancing wherever possible, keeping at least 6 feet. We're continuing to encourage folks to do thorough hand washing, 20 to 30 seconds. If you haven't already, go to YouTube and look at the WHO hand washing thing, because they have a whole thing about how to do that. Recommend that. Obviously, also wear face coverings anytime you're stepping outside, especially if you know you may not be able to keep distance from other people. Make sure you go with a mask and keep that going. We're also wanting to make sure that folks know that there are supports outside of, so there's social services supports that folks can access. If you visit nyc.gov/helpnownyc, you can see an array of services from the city, many of them from HRA, but from other places as well, that you can access to be able to receive services. And then certainly last but not least, I want to make sure that we mention that there are mental health resources via NYC Well, which is a toll-free number. You can dial 1-888 NYC Well, or you can text Well to 65173 and be able to speak 24/7 to somebody who's a counselor, somebody who's a therapist, somebody who can then or connect you to higher level psychiatric support if needed. Also, if you, the guidance that's been given out is about staying home if you're sick. But I'd just like to say, I think especially for people of color, if you have existing chronic conditions, sometimes your threshold for what constitutes being sick enough to get help might be different from everybody else's. And so just wanting to make sure that, if you do have chronic conditions and you start to feel an array of symptoms that are unusual, be it a fever, be it difficulty breathing, chest pain, abdominal discomfort, diarrhea, anything. If you just feel unwell, you don't have to get up and go to your provider, but we definitely recommend calling your provider. Also, if you're having any symptoms that you feel could be more serious, make sure that you're not rationing your own care. You're not holding back the health care that you need. And if you don't have health care, you can call our colleagues at HPSH, and I'll let Dr. Long speak to that. There's a toll-free number, 1-844-NYC for NYC, to talk to somebody who can help you connect to a provider. And the last thing I'll say is protesting is our right. It's a constitutionally guaranteed right. And we absolutely stand in solidarity with those who have made the decision to do that. I myself have done so, and I've taken my family with me. But please do practice. Wear a face mask when you go out there. Take some water with you. Stay hydrated. Try to keep some distance as much as you possibly can in those spaces as well. As you protest and push for equality, we just definitely want to say, make sure you stay alive and you're healthy to see and push for more change. And so take some of those precautions, but absolutely do not be silent. Absolutely use this moment to speak up. So I'll hand over to my colleague, Dr. Long, to take it from there.
All right, thank you very much, Dr. Manindo. So I want to tell you today about the Test and Trace Core program. My name is Ted. I'm a primary care doctor myself, and I'm our director of the Test and Trace Core program for New York City. The mission of the Test and Trace Core program is, during this unprecedented time, to prevent the spread of coronavirus across New York City. And we do that in one of three key ways, and I'm going to walk you through each of the three so you know what to expect and how we can help you moving forward as we're in the coronavirus crisis together in New York City. The first way is testing. Everything starts with testing, and as Dr. Manindo said, especially people, if you've been out there participating in protests, which is your right, we want to invite you with our arms open to come into one of our more than 200 testing sites across New York City. It's a free test. We want to make sure that you can get a test near to where you live, wherever you live. We want to encourage everybody to come out for one of these tests. And I want to also make the point that in New York City, we've really tried to support everybody to the maximum extent. And we're one of the only cities in the country that you don't even need to have any symptoms. You can come in today, tonight, we're open late, and get a test. You can get as many tests as you want. We have a universal testing policy out there. We're doing this to support New York. We're actually doing 30,000 tests per day right now of New Yorkers. And what happens is, for anybody that has a positive test, you enter into the second pillar of our program, which is tracing. What tracing is, effectively, is we call every New Yorker, regardless of where you had your test done, that comes back positive. We talk to you about what the coronavirus is. We ask you about your symptoms. We see how we can help you. And then we ask you, who have you been in close contact with, and can we call them? Do you have their phone number? And then we call them and we bring them in for testing as well. To share a couple of results about our tracing operation to date, we've actually been able to reach 97% of people in New York newly diagnosed with coronavirus and talk to them about what this is, what's happening. And then we've asked them about contacts or people they've been in close contact with. New Yorkers stand together, and I'm proud to say that among New Yorkers that have gotten through our interview when we call them, this is what tracing is, among those that have gotten through the whole interview, 74% of New Yorkers are standing there together to support New York City and have given us names of people they have been in close contact with. And now we're in the process of calling all of those people. Now, I'm proud of that 74%, but the reason we got there is a simple reason. Our tracers aren't people from other states, other countries. Our tracers are New Yorkers. More than half of our tracers who will be calling you on the phone are New Yorkers from our hardest hit communities across New York City, who understand our communities and who our communities trust. In the first couple weeks of the program, we actually, the rate of people giving contacts or people that they might have exposed to the coronavirus was solid, but it was a little bit lower. As the program is maturing, we're seeing actually the rate really jump up, that New Yorkers are feeling more and more comfortable when we call, because we are New Yorkers calling New Yorkers to take care of New Yorkers. One other statistic I want to give you about the program, and then I want to tell you about the third pillar of the program, is that since we started to do this program, when we've asked our new cases or people newly diagnosed with coronavirus to share with us contacts or people that would have been at risk for having the virus transmitted to them, there were 650 contacts that when we called them, they told us that they were already symptomatic and already, therefore, likely contagious. In that moment, we were able to work with New Yorkers to get them to isolate or quarantine to keep themselves, their families, and their neighbors safe. And in doing that, if the program didn't exist, if everything I've told you didn't exist, they would have gone out and may have infected another, on average, 3 other New Yorkers. So even in the first few weeks of having our new program, the Test and Trace Core, I believe that we've already, through just talking to the 650 New Yorkers that were already symptomatic, prevented a possible 2,000 new cases of coronavirus across New York City. This is just the beginning, and we're going to do so much, much more. But I want to really make the point that it is us New Yorkers doing this for other New Yorkers. These are New Yorkers taking care of New Yorkers. And we've stood together and we've bent the curve of the coronavirus together. We've earned the levels being as low as they are now, and we'll continue to work together to earn continued low transmission of coronavirus. And my job here is to help through the Test and Trace Core to make that happen. The third way that we're helping New Yorkers through our program is we want to give you everything that you need to be able to get through this, to keep your family, yourself, and your neighbors safe. About a third of all of the people that we're monitoring in our program now have told us that they need help in order to do that at home. They need help with food delivery, medication assistance. Maybe they have an eviction notice they need help with, or maybe they're having trouble with their job with paid leave, which by the way is state law. Over 2,000 times, we've paired them up with resource navigators that are working through that with them. And we're giving New Yorkers what they need, what they're telling us they need to be able to get through this together. Our resource navigators are also, through our community-based organizations, other New Yorkers. So everything that we've built up so far through our program is really hinged on keeping this as a local effort with New Yorkers taking care of New Yorkers. And we're doing this to prevent the transmission of the virus, keep us in a low transmission state. And we're going to be doing this through the summer and beyond. You may be getting phone calls from us. If you do, please pick up the phone. We're here to help. We want to talk to you about what's going on. And you'll end that conversation with us offering to give you things like food delivery, help with your medications, you name it, we're going to do it. The last thing I'll say in terms of how we want to help is actually something that Dr. Mendindo said. He mentioned that we have the 844 NYC 4 NYC number. And that's a really important piece for us too. If you're having symptoms now, don't wait. I totally agree with Dr. Mendindo. Call us now. That number will put you through directly to a clinician if you can't get through to your own doctor. And we'll talk to you about what's going on. We'll talk to you about your symptoms. We will help you. So with that, I'll turn it back. Thank you for having us tonight. It's a pleasure to be here and happy to answer any questions.
Thank you, Dr. Mendindo and Dr. Long. Now we'll go into a Q&A session about healthcare and health guidelines moderated by Domingo Estevez of Community Board 12, Washington Heights. Domingo?
Thank you so much. There's been a lot of great information. There are several questions. Give me one second. There are several questions, some from the public and some from CB members. Give me one second. I'm trying to pull that document up. So we got a question from some community boards. Please present on how the Department of Health and the DOH and the City of New York is working to eliminate the healthcare disparities that exist within the city, which were even more pronounced during the pandemic.
Okay, so the work to address health inequities, and let me also just say, there's the Dean of the CUNY School of Public Health on 125th Street came up with a term that I agree with completely. Instead of calling it health disparities, he recommends, and I agree with, calling it health consequences of racism and racial injustice.
Yeah.
And so we're going just to be very clear about what these things are. So the health department has been focused specifically on health inequities, the health consequences of racism, at least since 2002, in a concerted way when the health department looked at the neighborhoods across the city that had the highest burden of premature mortality, and that had the biggest racial gaps in terms of health outcomes. And it was identified that Central Brooklyn, including neighborhoods like Brownsville, East New York, Bedford, Bushwick, huge areas of the South Bronx, and then East and Central Harlem had the highest, those gaps were the highest in those neighborhoods. And so the bureaus, entire bureaus were set up with assistant commissioners, a full body of staff, including a research team, community engagement team. And those bureaus have been operational in those three neighborhoods, in those three areas, those three boroughs now for going on 15 years. I've been very proud to be a part of the Upper Manhattan team, and I'm now part of all three of them. But that's only one piece of it. The health department has been, through other programming, looking at how to close those gaps around HIV transmission in the city, around lots of indicators in the city. But I will say this: I think it's important for everyone to understand that it's not some type of biological thing whereby Black and brown people predominantly end up with these things. These things are the products of systemic policies. These things are the product of decades and centuries of sustained enforcement of these policies. And they are very deeply interwoven at the level of government, at the level of local government, state government, federal government, at the level of nonprofits, at the level of private sector in particular. And they also go along the line of residential segregation. So for a lot of us, we were not really surprised at all that these neighborhoods ended up being the places where COVID-19 concentrated, both in terms of the disease and the mortality, because those are also the same general areas where kids die from asthma. These are the same neighborhoods where folks die from diabetes. These are the same neighborhoods where kids don't necessarily complete school. These are the same neighborhoods where it's harder to get a job. This is the same neighborhoods where internet access is weakest. So all of these things, all these factors play together. But COVID-19 has come in and sort of moved very, very quickly and sort of really shown all those things to be true. So within DOHMH, there's an equity action plan that I'm a part of. I am co-leading that with some other colleagues that is looking at strengthening clinical providers in the community, community providers, CBOs, community-based organizations, community clinical providers, as well as residents in these neighborhoods. There's a focus on night shift tenants. There's a focus on elderly tenants. There's a growing focus on youth, and there's a focus on homeless people. So there's a different ways we're trying to slice this in partnership with other city agencies, in partnership as much as possible with community-based partners. And we've constituted a community advisory board that came together very, very quickly. And we're working together with our colleagues at H+H to have them be able to inform a lot of the work that's being done. And so I say all that to say that the work of dismantling and disentangling the impact of racism and discrimination for centuries is a very long and ongoing thing. And we have to have a commitment across the board and an ongoing commitment to do this hard work and to challenge these issues, and for all of us to have an honest realization of what needs to happen here. And a lot of that is going to be something that we all have to collaborate on together.
Yeah, and that's I think you hit the nail in the head, Doctor. Because this is nothing new. What we're seeing is right now is the amplification of the implications of the systematic, as you stated, racism and its systematic ramifications. So thank you so much for being so eloquent. We have another question around some experts are suggesting that we may have a second wave in the fall. How is the city of New York working to ensure that this pandemic does not devastatingly affect communities of colors like it did in the first wave? And I believe you did touch into it. So now the question is, understanding that this is real, how could legislation and any component that's impacting, that's maintaining this systematic amplification that we're seeing of the disparities. But Doctor, go ahead. So it's more, I believe, summing it up is the second wave. How would the city is going to be prepared for the second wave?
Absolutely, that's a great question. Yeah, no, the health department is, I think internally we're very clear and tracking different modeling, different models that are out there, sort of predictive models that are sort of looking at what could happen in different scenarios. And I think it's fair to say that there may very well be another wave coming up in the fall or sometime at some point in the not too distant future. And so I think right now there are teams of people doing forward planning and thinking about how we build resilience early on, so our defenses are not sort of breached the way they were back in March. And so we're really looking at how to do things differently this time around, and that includes, for example, just sort of what capacity building can be done now for especially community-based organizations who are trusted partners in the community. How can resources be funneled to them? How can they be strengthened? And how can we interact? How can we collaborate as agencies, city agencies, state agencies, and others to really get ready for what may very well be the case?
And this will segue, Doctor, to the next question, because I feel like you're addressing it as you are speaking. With the introduction of phase 2 today, how will DOH make sure that restaurants, salons, playgrounds, etc., are cleaned and monitored to prevent the virus from spreading? And I feel like that's more about, like you were tapping into it, how can we provide the resources to be able to take.
How come
Yeah.
they can't see me?
Yeah, right. And I so absolutely, I
That's
think
Dr. Moliendo.
the DOH does monitoring.
Angel, Miss Kane, you gotta mute your mic because we can hear you.
To the extent that DOH, monitors, say, restaurants or whatever, I think that will go on. And our colleagues who are doing, like our colleagues in parks, for example, I'm sure and others will have a role in how we are tracking all of this. But I think we also, we're collaborating with Dr. Long's team and others, as if and when information emerges about, new clusters, if and when information emerges about, a spike in cases, maybe it's just hyper local in one part of the city, or maybe it's citywide or whatever the case may be. I think there's a very close monitoring of those numbers, and then sort of trying to see what is the appropriate response, either at that hyper local level or however it is. It may be in a specific set of buildings, it might be within a certain geographical area, and that type of thing. Whatever the case may be, I think, or a certain population of people. I think right now a lot of work is being done to establish connections, to share information, to gather information and get a sense of where things are. And then, should there be a spike, I think, we'll work with other folks to begin to maybe even begin another shutdown, and to be able to get out and reinforce some of the things that help to reduce transmission. But I think it'll be a joint effort with a lot of our colleagues from the other sister agencies, some of whom are on the call today, and they may have something to say about that as well. But to the extent that DOH is responsible, we will absolutely be, and we are currently keeping an eye on that right now.
And how feasible is the idea of reopening senior centers, considering that the whole idea of a senior center is to congregate?
Right. I think there'll have to be a rethinking of how these places operate. Like you said, some of what they were established for is no longer something that we can necessarily do. I do think that, so the same with schools, for example.
Okay.
You have to rethink what that looks like. Sorry, did it sound like you're about to say something? No? Yeah, no, I think that will just be something that is carefully monitored. I think, as I understand it, I think there's a much slower process for nursing homes and for senior centers. I think there's also a concern about a heat wave every year. I think we experience some degree of heat wave. It's thousands of people, particularly seniors who can't get out. And then the cooling sites tend to be places where people come together. So we have to think about that and think of different types of places that could be cooling centers, maybe houses of worship, maybe other places that could be cooling centers. And so that we can keep the distancing while also allowing people to stay cool. The heat waves take lives every year and also cause a lot of illness every year. And so we're keeping an eye on that, even as we think about possible waves of COVID in the near future.
And what is the possibility of opening more preventative care clinics in the community through holistic measures?
I don't know if I should leave that to Dr. Long.
And let Dr. Long answer it, because I already know Dr. No's answer.
Yeah, that's a great question. And actually,
He's not going to give the full answer either. Go ahead.
if I can rewind for a second, just to add one thing on to what Dr. Mendindo was saying, is that one of the ways that we want to do our best to work together to prevent a possible second wave is to have the test and trace core really do our work to identify people that have been exposed to the virus, bring them in for testing, then get them to quarantine so that nobody else can get infected by the virus. And that's a key mission and charge of the test and trace core. This is something we didn't have in round one of the virus, but we sure have it now when it's ready. So all I would ask of everybody listening here is heed our call when we call. If we call, it's going to be to talk about how to prevent the spread of the coronavirus in New York City. And we can only be as powerful and do as good of a job as the people that join us together to make the program work and to identify contacts with people that have been exposed and to work together to prevent the spread of the virus. So I just wanted to say that the test and trace core is a tool we didn't have before, but we have it now. In terms of further preventive care, as a practicing primary care doctor in the Bronx, I apologize, Manhattan Borough President.
Terrible, terrible.
But I practice at the Morrisania Community Health Center, and my personal mission and our mission in life is to provide as much preventive care as possible. And it's actually been challenging to do that in the context of the coronavirus. But I'm happy to say that we actually are reopening our clinics this week. We're doing a lot more telemedicine visits. We've actually done hundreds of thousands of telemedicine visits for people across New York City now, and we're going to keep that going. And if we bring you into one of our clinics, again, one of our reopened clinics, of which we have many in Manhattan, Upper Manhattan, we're going to have a fast track to bring you in and out to get the preventive care. So you may need blood work, a mammogram, other things like that. We're going to sequence it for you, bring you in and out, make it very fast, and make it very safe for you as well. So those are ongoing things that as we reopen our primary care practices across New York City, let us know what more you need. We're here for you, and our only goal is to give you the preventive care that you need. So let us know how we're doing as we reopen, and we'd love to keep in touch.
Fantastic. Yeah. Thank you both so much. Thank you, Dr. Long. Thank you, Dr. Mendindo. And thank you, Domingo from CB12. That was a great informational session. We really appreciate your time tonight. Next up, we're going to have, we'll have New York City Parks Department discuss how the city plans on reopening public spaces and other parks. We'll have the Parks Borough Commissioner, William Castro, join us tonight. We'll also have Chief Russell Green of NYPD's Patrol Borough Manhattan North here to answer any questions related to enforcement. So now I will begin to share my screen, and Borough Commissioner, are you ready?
Yes, I am.
Perfect.
Good evening.
One moment. Okay, can y'all see my screen?
Yep.
Perfect. Go ahead.
All right.
Borough Commissioner Castro?
Yeah.
Right. Oh, perfect. We have the slides up.
Okay, great. Well, good evening, everybody. I'm sorry I'm not with you on Zoom. Tried to do that, but wasn't able to. But so you can pretend this is the old days of radio, maybe. All right. So in any case, I think you can all see on the screen our plan for reopening the parks and playgrounds to the public. And I think, as most of you know, today officially we started reopening the playgrounds. I know that parents and children and grandparents all consider this a red letter day. It's finally arrived. I know everyone's really been very patient about it all, but now is when the children who are finishing up school, some have already finished, really have been wanting to get out, and now they will be able to go to their local playgrounds. Here in Manhattan, we've opened up virtually all the playgrounds today. I think there are a couple that we need to put up a shade structure and a few other things, but they should all pretty much be open by tomorrow. Now, we have not opened a few properties and facilities, as a lot of people know, due to executive orders from the mayor or the governor. So as you see on the screen, some of our parks recreation centers are still closed for use as recreation centers. However, some of them are being used for people to get food, which has been a tremendous program that the city has offered. I'm very proud that the city has done this because it, of course, has been very hard for people who have either lost their jobs or had difficulty gaining access to food. And this is a way for anyone to get nutritious food. And so we're very pleased that is happening at some of our recreation centers. Thomas Jefferson Recreation Center in East Harlem is one of them. The nature centers are closed. Historic houses are closed. We still have some of the parks concessions closed. Amusement parks and carousels, skating rinks, we're not really concerned about that for tonight. But the ones that still are closed and that we hope will be opening fairly soon, I know the mayor discussed it briefly today, and we'll see how this goes, are the basketball and handball courts, the bocce courts, volleyball courts, and then the barbecuing areas that people enjoy, and the dog runs. And Commissioner Silver and I were talking earlier today. We know that there are a lot of people who want to gain access to the dog runs, and we understand that. And, you know, all of these, I think, we're coming soon to reopening, but nothing has been decided yet, and we just ask for patience for a little bit longer. On the next slide, as I was saying just a few minutes ago, we've really opened up the parks and our open space. All the playgrounds are opening now. The outdoor adult fitness equipment is fully open now. I know a lot of people have really wanted to use it. The community gardens are open for gardening activity. And the bathrooms, the comfort stations are open, except for those that are under capital renovation. And certain parks concessions have opened. Some of the restaurants, they're open for takeout and delivery only still. The marinas, the boat yards, stables, farmers markets that people really enjoy, and they've done a great job. Grow NYC, they've done a wonderful job in social distancing with their farmers. So that has really been a big part of the opening, and more to come. A couple of our, as I said, a couple of our facilities have been repurposed. So Pelham Fritz and Thomas Jefferson have been food distribution sites, and the Highbridge Pool has become a major testing site for the coronavirus, and it's a tremendous facility. And if people want to get tested in Northern Manhattan, that is certainly one of the locations that you can go to. The mayor has opened up 30 miles of streets adjacent to parks and some inside the parks in Northern Manhattan. Fort Tryon Park, the roadway, the interior roadway is open. Areas adjacent to Carl Schurz, excuse me, Highbridge Park, Lieutenant William Tage Triangle, Colonel Charles Young, Jackie Robinson Park, and then Morningside and Stuyvesant Square parks have these open areas to give the public greater places to go out and to distance even further. In terms of park properties and programming, we've done some virtual programming and tours of different parks. Jennifer Hoppe, our Northern Manhattan administrator, is on this town hall, and She has been trying to get things going in terms of virtual programming for Fort Tryon and Inwood and in High Bridge. So we're working on those, and our Recreation Division is working on programs to get them out to the public, but we have nothing to announce yet at this time. Now on capital projects, these are the renovation projects that go on in our park system that are very important to really updating our equipment and play areas and reviving our historic facilities. These are starting to really move now. Now, even during the last 3 months, the design work has continued, and meetings with the community boards have been continuing virtually. But now we're getting the construction going again, and the vast majority of the construction projects are moving forward as part of this phase, and we're very pleased that that's going to start to accelerate, and you'll start to see that as well. In terms of parks permitting for events and athletic permits, we have not yet granted special event permits. This is something that is true for June and July. We're going to have to see soon what we're going to decide going beyond that. But right now, we're not entertaining special event permits. In terms of organized sports, athletic permits, we are accepting applications for athletic field and courts for the fall, for this fall, September 1st to November 30th. We have not agreed to allow them to happen during the summer. We will see if that changes, but certainly right now it's only for the fall. Signage to protect the public. We've installed thousands of these advisory signs throughout the park system. And it just reminds people about the closures and the social distancing and the need to really have masks. As I go around, I see so many people wearing masks here in Manhattan, and that's really the best way to really protect yourself and other people, along with keeping a good, healthy distance, at least 6 feet, more if you can, staying away from crowds, and washing hands and not touching your face. It's something that we all have to remind ourselves and others about in our families and friends. It's human nature to, not want to abide by these things sometimes, but it's really extremely important, as I think everybody here, certainly in New York, understands by now. So we have these signs that give a little reminder to people as they go about in their parks. People like to sort of relax when they get out into parks, but it's important to keep your guard up going through this year. We've given away over 500,000 face coverings at over 77 parks when we had a big drive in May, and we've continued to do this. Our Park Enforcement Patrol, the Urban Park Rangers, and a really great group. These are mostly recreation staff, but now the mayor's given us funds to hire additional people, what we call park ambassadors. And these are people, Commissioner Silver thought of this idea several months ago, to go out and gently remind people to keep social distance and to give out masks when they can, and they are continuing to do that. And they give out hundreds and hundreds of masks on a daily basis, and we're going to continue that as well. With the playgrounds reopening, excuse me, we're also having ambassadors go out to as many playgrounds as we can to make sure that people are distancing and to give out masks where we can. So we're going to keep a close eye on that. In terms of our own staff, they are essential workers, and they've been working right through the pandemic. And we give them gloves, face coverings, eye goggles, hand sanitizers on a biweekly basis. And that's really helped keep the infection rate much, much lower than it might have been. Also, being outdoors, of course, is certainly very important, but they go in and clean the bathrooms, and they have to, be among the folks who are using their parks. So it's very important, of course, like everyone else, for them to wear a mask and to have masks and gloves available. Excuse me. Our office staff, there's still, a lot of them are teleworking, and we think that's a good thing. A lot of work is getting done. It also reduces the congestion in offices and makes it for a safer environment. So basically, I want to wrap up here. You know, we are restarting our efforts, just like everyone here. We want to help the public have a safe and enjoyable and relaxing time in their parks. And anything we can do to assist, we really will be doing it. And on behalf of Commissioner Silver, I want everyone to know that your park workers are working very hard and have been throughout this pandemic to take care of your parks and to turn around and reopen them as quickly as we can. So thank you all very much.
Thank you, Borough Commissioner Castro. We greatly appreciate your participation in tonight's town hall. As a reminder, before we move into the Q&A session, we do have NYPD Deputy Chief Green here as well. So now we'll go into the public spaces Q&A session, which will be moderated by Carly Wine, the Assistant District Manager of Community Board 11 East Harlem.
Hi, everybody. Thank you so much. I'm really glad to be here. The presentations so far have been really informative. I also want to thank Commissioner Castro for his presentation. It hit on a lot of the questions that the community boards have gathered. Just to be clear about how I will proceed from here. First, I'm going to direct questions to Commissioner Bill Castro, and then I'll direct some questions to Deputy Chief Russell Green. Okay, so I'm just pulling up my notes and my questions here. Okay, so like I said, a lot of your presentation hit on the questions that we do have, but I am seeking some clarification. So first, how does New York City Parks plan on cleaning the playgrounds? Is there like a maintenance schedule? Can you detail that for us a little bit?
Yes, the playgrounds will be cleaned as they have been. We lock a lot of our playgrounds at night. Not all of them, but a lot of them. We have a special crew that comes in at night. And that's good because it allows them to be secured, reduces any potential vandalism or misuse. And then we open them up early in the mornings, and we go in and then we clean them in the morning to make sure they're ready for the public coming in. So we open up the bathrooms, we clean the bathrooms, make sure they're clean, clean the playground. If we've cleaned it towards the end of the day, it's harder to do in the summertime because people are using them very actively, and we try to close them as late as possible so the public can enjoy them. So typically what that means is we have to come in early in the morning and clean them, and that's the way we do it. We're not doing any special kind of cleaning of the play equipment per se. We will, obviously if there's a problem, that's dirty, we will clean. But the sunlight is a very good way of keeping the play equipment in good shape. But obviously people do need to exercise, reasonable caution. I know kids like to touch everything. But we clean the park thoroughly. We clean the bathrooms. We use hydrogen peroxide solution in the bathrooms to fully sanitize them. And then if we can, we clean several times a day in the playground if we have a fixed post staff person. If it's on a mobile crew, then typically we clean it once and possibly twice later in the afternoon after lunchtime.
Okay, great. Thank you so much. So the next question is about the enforcement of social distancing. And I know that you had mentioned the masks being handed out, that you're working with PEP officers and NYPD, but can you detail a little bit more how you are working with NYPD? And yeah, so on the slide, it had said something about 150-day patrol, and I guess I just wanted to understand that further.
Yeah, well, each park supervisor has an app, and if we see a social distancing problem, most places it's pretty good. People are observing that. But where we see sometimes people getting too close or a bit of a grouping, they can put that on their app, and we get that's shared with Park Enforcement Patrol. and as well as the park enforcement on their own patrolling see things. But it feeds it all into one central location very quickly on an app. And then the Park Enforcement Patrol could go out and give attention and education to the public. That's worked well. We continue to do that. If the park enforcement can't handle it, if there's, and that's rare, then they reach out to the police department to see if they can be of assistance. But our main strategy is to basically send out Park Enforcement Patrol to address this, as well as our ambassadors. We've been able to hire another 55. The mayor's funded recently in Manhattan. So we've hired an additional 55 people who are ambassadors to help us get out there and cover areas. And that's really the best way. Usually people, when they understand what the issue is, they comply. But park enforcement is sort of our front line. And then if we get into any serious situation, then we reach out to the police.
So when you talk up a little bit louder scale. Thank you.
Thank you. Okay, so another major, discussion that's happening across the city are the budget cuts that that resulted as because of COVID-19 and the budget shortfall. Can you tell us a bit about what likely is to be cut from the parks budget, and also detail how budget cuts are going to impact the capital budget, capital projects, excuse me?
Yeah, I wish I could, but I have no idea. The budget is being, put together now, be voted on soon by the city council. But I do not have any inside information on what is might be cut and in terms of the impact. So I'm sorry, I really can't answer.
That's all right. And then lastly, what advice do you have for patrons who want to protect themselves from the virus and use the park?
Right. Well, I think I stated before, but it's always good to say it again. Based on our experience and the knowledge that we have, the best thing to do is always wear a mask. Wear a properly fitting mask or face covering. As everyone knows by now, I think, it protects other people by really reducing the amount of any droplets or virus that comes out from a mask. I've seen this on CNN, and I'm sure a lot of us have, where somebody without a face covering, they can really project out quite a number of feet, 10, 20 feet sometimes in a sneeze, something along those lines. But when you put on a face covering, it only goes a very short distance, like, I don't know, I think a foot or something from what I've seen. It's really very limited. And that's a tremendous protection for you and everyone else. So the face mask is, even outdoors, where it's much less of a risk than it is indoors, it still is important. Stay away from crowds, from crowded areas if you can, and keep that social distance. The mask and the social distance, there's sort of multiple layers of defense. And there's sort of three main layers: the mask, the distance, and not touching your face and washing your hands as part of that. And if you do that, you're going to be fine.
Hey, Carly, whenever you have a Domingo from CB12 have a question, just let me know.
Okay, sure. I actually do have a question. Is there any information being shared with parents on hand washing after each use while at playgrounds? At parks?
I quite catch that. Could you say that one more time?
So as far as outreach, is there any information being shared with parents on hand washing after each use while at playgrounds?
That's a good question. I'm going to look into what the plan is. I mean, the ambassadors will tell people that, but I think that's a very good question, and I think that would be useful. So I have to see what we can do about that. You always need to keep educating people. And unfortunately, there are people who seem to ignore common sense or just need reminders because they're busy. And so that's a good thing. I'm going to look into that and see what we can do to do something like that.
Okay, great, thank you. And so your presentation was pretty thorough about what aspects of parks are remaining closed, including the basketball hoops, courts, and dog runs. And I know that you had also mentioned that you're not sure about programming yet and you're looking into it. But still, we wanted to, there was a question for the public that asks how the Parks Department plans on supporting youth this summer, being that SYEP, Summer Youth Employment Programs, are closed.
Yeah, well, right now we don't have any programs like SYEP in parks. And we're looking at some programs, as I said, Recreation Division is looking at different kinds of programs, but they haven't developed them fully yet. So I have nothing to really announce. But we're always working on different things to address some of the needs that are out there. But we'll have more to say about this, soon.
Okay, thank you so much.
Domingo had a question.
You're welcome.
Yeah.
Yeah, so Mr. Castro, my biggest concern is understanding like this whole conversation is speaking about people of color and the disproportionate impact on people of color. My biggest concern is the fact that the Parks Department and there's no programming conversations yet, when I feel the people that should be engaged are the people that do programming every summer, because we're talking about, again, disproportionately impacting a big group of youth of color by limiting the programming that's happening in these parks, right? So for instance, by taking away the hoops, we're just encouraging kids to walk around in our communities and be put in a position that could potentially hurt them, So my biggest concern is, and my suggestion, I think there should be a bigger conversation around how to use these spaces. For instance, maybe the courts with social distancing, and maybe encouraging workouts without while maintaining the 6 feet rule, right? But I do think it's important for us. SYP's already canceled. I feel like it'll be a big disservice if parks turns their back on the kids too, because there is nothing for them to do besides virtual. And I feel like parks do have the ability, with other thought partners and other people who do programming within our communities, to come together and put something that really helps our kids maintain engagement throughout the summer.
Right. No, it's, giving young people something to do for both their own health, exercise, to get out, their own development, psychological development. And it's been very hard for youngsters to be stuck indoors. It's a real mental health issue too. I've seen that with my own family, and kids really need to be out. They need friends. They need to do things. And then if you want to talk about older youngsters, things that are positive so that they're not at risk at getting involved in things they shouldn't get involved with, and they have more positive supervision or encouragement and development. So the problem has been that we really haven't been able to do those kinds of things because of the health risk. Now with it being reduced, not eliminated, but reduced, I know our Recreation Division, as I said, is looking at, I don't know what they are. I don't know what the programs are. They haven't said, but they're looking at trying to come up with some things that will work for kids, youngsters, teens, but that is also, healthy. And your idea is very good about the keeping the social distancing. Are there other ways of looking at this issue to provide programs? And what I'm going to do is talk to the Recreation Assistant Commissioner tomorrow to get a better understanding, because she brought it up today, as to what they're considering and to see what can happen. Because I agree with you. The kids have really had a tough time, and now that it's summer, they really need some way to be in a safe environment, doing something that's positive, and it's very important for them.
And remember, you got CBOs who are thought partners, so it shouldn't only be done by parks.
Exactly.
I agree.
Carly, I just want to add back up, Domingo. Obviously, I've been a pain in the neck about this, but we need permits in the parks for the CBOs. They're either on the street or in the parks. And you know this, Bill, but for God's sake, I'm going to do more press conferences and more screaming. Permits in the parks. And I don't know what to do about this basketball situation, but somebody has to make a decision, rims or not. And if you're not doing the rims, then what are we doing with the courts? Maybe we could do workouts in the courts. But something has to happen in those courts. It can't just sit there. And then, of course, we have a million questions about dog runs. So please, I mean, that's pretty much social distancing. I don't know what the holdup is there. So I just want to bring those issues. But permits. But the CBOs that know how to do it. We love parks and they can do some programs. We definitely need those permits now. We have the health department. We have the governor. We just need the Parks Department permits. Thank you, Carly. I can go on and on. Bill knows that. Enough already. Get those damn permits.
You know, Carly, before you move on to the NYPD, Borough Commissioner, do you mind talking a little bit about when Parks Department will open up dog runs? We have several questions about dog runs in the chat, as well as about grilling areas.
Yeah, I know that it's very important to the public to have the dog runs open and the grilling as well. And there's no decision has been made on that, on either of those, or on the courts. But I believe the mayor was discussing it at his press conference this morning, I believe. I didn't get to hear it, but I heard that it was mentioned. We're very aware of the desire of people to have access. And so I think things are moving in that direction, but I don't know, we've had no indication of when this will happen. But everyone is aware. There's a lot of people have been talking about it, reaching out to everyone. So we understand the demand and the interest, but nothing has been decided yet. But we clearly want to be able to do these things. But I have to say, you know, this mayor and this governor, they're being intelligent and cautious about things where we haven't perhaps seen that in some other parts of our country. And I think we have to be careful how we reopen because we don't really know what is going to happen as we reopen. And so a cautious approach is the wisest approach. And I think they're being wise about this. And let's see what happens in the next few weeks on these issues.
Thank you so much, Borough Commissioner Castro. I'm going to move on, if that's all right with everybody else, to some questions about enforcement directed towards Chief Russell Green. Thank you for attending tonight. So I'm just going to read them out here. So how does NYPD plan on helping restaurants maintain social distancing?
Okay, good evening, everyone. Chief Green, Manhattan North. So a few things with that. Social distancing complaints that are inside locations, it's my understanding that they're not going to be routed to the NYPD. Those are going to be handled by other agencies. Inspections of businesses to ensure that they're in compliance is going to be under the direction of the Mayor's Office of Special Enforcement. The one thing that we would be still tasked with addressing would be those type of complaints that happen outside. However, with phase 2, I know a lot of people have been asking questions about the open containers of alcohol outside restaurants and bars. With phase 2, the mayor's executive order suspended open container laws in front of those establishments. So there won't be any need for any enforcement. Anything that comes up outside that would fall under the realm of social distancing would just be instructions, warnings, directions to get in compliance, and if necessary, referrals to other agencies like SLA, Consumer Affairs. It's been our experience, what I've seen, you know, again, earlier than today when phase 2 started, was a lot of the people, even back to parks compliance, a lot of the individuals that are not distancing live in the same household. So a lot of the times when we would actually engage people and discuss, you know, social distancing and move 6 feet apart, they're related, they're, you know, spouses or they're, you know, extended family members who live together. So pretty much we're out of the enforcement business and just more in the instructing to gain compliance. But again, the open containers of alcohol outside these establishments, that's been suspended. So we won't respond to those type of complaints.
Okay, thank you. That actually, so you mentioned it a little bit about the enforcement outside of restaurants and bars, but I'm going to read the question anyhow. So we've seen that large crowds have already begun forming outside of bars and restaurants across the city. How will NYPD make sure to address these gatherings while not disproportionately enforcing communities of color?
Okay, so again, we're not going to be issuing enforcement by the way of any summonses. Those open container laws were suspended. Prior to today, when they became phase 2, we were just giving instructions and more making contact with the bar or restaurant owner, and trying to get them to have people take their their orders and their beverages for off-site consumption home and not linger out front. But again, that's a moot point now as we're in this phase 2 stage.
Okay. So the next question. The mayor's initiative calls on restaurants and other businesses to self-certify their establishments. Does NYPD have a plan to handle the new traffic issues that may arise due to these open restaurants? And how will NYPD handle the rise in noise complaints once restaurants begin going into the streets?
I'm not exactly sure what self-certified means. To the best of my knowledge, the restaurants and bars are going to be able to set up outside dining, I believe on the sidewalk. As far as it extending into the street or locations where maybe already designated certain hours open streets, I believe that's going to be under the control of DOT. So just offhand, I would say if it extends into a street or a parking lane, we would look at each location with DOT on a case-by-case basis to see if it called for any kind of barrier, like a concrete block, or if it required closing a lane of traffic, where we would become involved with either a police car or a traffic enforcement agent or something like that. I think those will have to be case-by-case with us and DOT to look at each location. As far as noise complaints, that really wouldn't change the way we usually would respond to a noise complaint. I don't know that there'll be an increase or not. Today's kind of that stage of reopening, so we haven't had any data to look at as far as an increase. That would be handled by each precinct commander. Again, liaison with the establishment ownership, speak with the community boards. And again, it would be referrals to most likely SLA, Consumer Affairs. A last resort would be summonses, and I really don't see that as being any way of a viable option at this stage.
Thank you. Yeah, I am interested to see how that'll play out.
Yeah.
So the following questions I'm going to ask you were submitted by the public. So what support will the community have in addressing certain quality of life challenges, including drag racing or the fireworks that we've been seeing when Uptown reopens?
Yeah, so as far as quality of life complaints, we are still in the business of enforcing quality of life. Unfortunately, what we've seen recently is there's a lot of reluctance from the various district attorney's office to even entertain or prosecute something like a disorderly conduct or a noise violation or a dice game. So I think that those are conversations that should continue with the respective district attorney's offices. I'm certainly not going to speak for them, but I have seen a reluctance even through the earlier protest stages of them to prosecute or entertain any quality of life summons enforcement. Fireworks is a crime, so just to get into fireworks, I have heard them here. Certainly throughout the past week or so just by being at work at night. Fireworks, possession of fireworks in New York City is a misdemeanor. It's still a crime. So certainly if police responded and saw somebody committing a misdemeanor, which is possession of fireworks, they would be within their rights to make an arrest. And I expect that they would make an arrest. Just some of the logistical challenges with fireworks, as many of you know, just by probably looking out the window. It's very difficult when these calls come in to 311 or even 911. It's difficult a lot of times to find out where they're coming from. Some are coming from rooftops, some are coming from courtyards, and just the reverberation off of a lot of buildings. Sometimes a caller may call it in and, you know, reports fireworks outside here on 100th Street, and meanwhile it's 3 blocks away. So I just know from personal experience working here in Manhattan and also in the Bronx that sometimes we get those and we go to the location where it's reported and it's not even occurring there. So then we have to redirect and try and figure out just through visual and audio where it's coming from. And by the time we get there, it's completed and, you know, there's nobody observed to be in possession of it. So those are some of the challenges, but fireworks are still enforceable. They're dangerous. And again, it's a misdemeanor in the city. So those are outright crimes.
So can you speak a little bit to how NYPD is addressing the fireworks issue? Has there been any enforcement? I know you said it's challenging to find out who is setting off the fireworks, but has NYPD made any progress?
As far as enforcement or arrests, I'd have to get back to you. I'll make a note of that, and after the meeting, I'll make some inquiries, and I can circle back to April and get her some kind of report, at least for Manhattan, for Manhattan North, and then I can try to make some connection for any citywide enforcement numbers. I don't have that in front of me here.
Okay, thank you. And then let's see. So the last question. So there's been some concern about NYPD officers not wearing masks. And this question asks how the public can go about, how is that enforced by the police department?
Okay, so we have been instructed by the police commissioner to wear masks when we're in situations where we're not going to be able to be socially distancing from people. Like obviously right now I'm in my office, nobody's anywhere near me. I'm okay, but if I was to respond out to a meeting or whatnot out in the street, or have to travel to an office building outside, we're supposed to wear them. You know, it would basically become an internal disciplinary issue up to a precinct commanding officer. In other words, if the CO downstairs sees me out on the front steps talking to people and not wearing my mask, he or she is supposed to correct that. And if it's not correctable, you know, verbally, they issue, you know, internal discipline to the officers concerned. What I've seen, again, I know it was discussed earlier, I'm seeing a lot of compliance in the public, and I'm seeing almost 100% compliance wherever I travel with the officers. I think that would just be, if it was observed, it would be, you know, to the local precinct, to the precinct commander, or certainly anywhere in Manhattan North could be a complaint to come in through me, and you know, I would investigate and address it. But we are definitely expected, when not able to be apart from people, to be wearing them.
Fantastic. Thank you so much, Carly, for moderating this portion of tonight's town hall. And thank you, Deputy Chief Russell Green, as well as Borough Commissioner Castro. We really appreciate y'all's participation in tonight's town hall.
You're welcome.
And I will connect with you about some of the data about how the fireworks have been enforced, because I don't know if you've looked into the chat box, but there's a lot of activity going on in the chat about fireworks. So,
sure.
But next we'll go into our reopening businesses segment. So Miguelina Aristi, Director of Intergovernmental Affairs for the Department of Small Business Services, will present on what businesses need to know to reopen properly and confidently. And then we'll follow that with informational remarks from the Department of Consumer Affairs and the Department of Transportation.
Thank you, April. Can everyone hear me okay?
Yep.
Okay, thank you. Good evening, everyone. I'm Miguelina Aristi, as April said, Director of Intergovernmental Affairs at the Department of Small Business Services. I want to thank you, April, and my favorite Manhattan Borough President Gail Brewer, because I live in Washington Heights, so I am a constituent, for the invitation to join and speak with you all today. You know, at SBS, it is extremely important for us to connect with partners like yourself and ensure that you all have the most up-to-date information about resources that you can also share with your constituents and folks that are emailing you and asking you questions about what is going on in the city and state. So at the Department of Small Business Services, our first job was to educate and help our small business owners understand the reopening process and get them ready to come back. You know, we've heard from a lot of business owners that they were anxious and they were ready to start operating. So as you all know, today we reopened the city for phase 2. So meaning offices, real estate, in-store retail, vehicle sales, leases and rentals, retail, rental, repairs and cleaning, commercial buildings. And I think one of the most important ones for a lot of people are the barbershops and hair salons, and also the outdoor dining were permitted to reopen. So as these establishments reopen, obviously they're looking for guidance from the state and the city, and our goal really is to provide these business owners with the help they need to navigate the recovery. So I'm just gonna share a couple of the basic rules that we are encouraging small business owners to abide by. I'm sorry if they have already been shared, but obviously we encourage employees to stay home if they're sick, keep 6 feet of distance between employees, keep 50% capacity or less for your business, practice healthy hand hygiene by washing your hands often, provide free face covering to their employees, and wear masks, wear masks. So SBS has actually been working with local partners such as the Uptown Grand Central on 125th Street, the Washington Heights BID, and the Women Chamber of Commerce on distributing face masks. We actually have a corridor walk scheduled for this Thursday in the morning, which we will be joining Kenya Brew from the Women's Chamber of Commerce and the Washington Heights BID in distributing face masks. Really encouraging those barbershops and hair salons to, that just reopened this week, giving them practical guidance and face masks so that they can continue operating safely. So for those that are looking to get a hand of those guidance, you can visit our website at nyc.gov/business. You can also encourage your constituents, restaurant owners, to call our hotline at 888-SBS-4NYC. And that number is 888-727-4692. For more information, we have experts taking the calls and making sure that people are guided the correct way. You know, one of the things that for businesses opening in this phase that we're doing is, like I mentioned, for salons and barbershops, you know, we encourage them to have by appointment only policy, which limits walk-in customers. You know, all these tips again are at our guidance flyers, which you can find on the website that I mentioned, nyc.gov/business. Some of the resources that we have, SBS from the onset of the pandemic, we quickly launched several resources to help reopen businesses. Last week, like I said, another 2 million face coverings were distributed by us working with our local partners. That was during phase 1. Actually, for now, that total is up to 4 million face masks. We launched the PPE and reopening supplies marketplace. It's a one-stop shop for easy access to suppliers of face masks, face shields, gloves, cleaning products, physical barriers, portable furniture, and more. This is very exciting because this was a direct result from the commissioner talking to minority-owned businesses who were having challenges in purchasing supplies. So again, that we launched the PPE and Reopening Supplies Marketplace. For more information on that, you can go to nyc.gov/business. We also have a centralized restaurant reopening page with guidance and best practices for restaurant industry across all 5 boroughs. We are conducting educational webinars and trainings for phase 2, which started today. All of that information you will be able to find on our website. We partner with our sister agencies, which I see a lot of them here, for resource fairs, and we have a series of live stream conversations to help business owners reopen. You know, from the very beginning during phase 1 and from the very beginning of the pandemic, we have been able to connect small businesses, specifically minority-owned businesses, to $66 million in assistance through our lenders and philanthropic funding. Our hotline, which I mentioned, has received over 12,000 calls, just people looking for guidance and looking for information on PPE and what exactly they have to do in order to operate safely. We're in the process of distributing 330,000 plain language guides in all 10 languages. Our 18 Workforce One centers are working with over 400 essential services employers to fill over 5,500 positions at nursing homes, community hospitals, grocery stores, pharmacies, etc. So we've also hosted 12 webinars with over 250 attendees. And, you know, as we all know, this administration and the commissioner have tried to think nimble and creatively about how to make sure that restaurants can open and do so safely. So the mayor announced the Open Restaurant Program. So it's guidelines for outdoor dining as they reopen for this phase 2. The proposal limits our commercial corridors and provides businesses with much needed opportunity to generate further revenue while social distancing. You can find more information again on our nyc.gov/business page. I'm sure that's something that a lot of people are talking about since it's something that started today. You can also find information on nycopenrestaurants.info for all the details on that. You know, the commissioner has been doing a 5-borough tour, visiting corridors in all 5 boroughs since the reopening in phase 1. We're doing that again this week. And, you know, his goal is to really listen to small businesses, walk the streets that, you know, constituents and we all walk to make sure that everybody is abiding by the safe rules. And really just to make sure that he's connected and then take their feedback to the administration and think creatively about how we can further help small businesses. That's about it for me, but thank you. I know that you have a couple of questions.
April, you're on mute.
Yeah, April, you're on mute.
Of course. Sorry.
I thought it was my
Yes, so right now we're actually going to hear from Tangela Rahman and Alberto Roldan with the Department of Consumer Affairs, and followed by notes from the Department of Transportation. Tangela, before I let you take it away, I just want to remind everyone that if we happen to not get to some questions that were posed in the Q&A, I'm going to put my contact information there. Please send me an email anytime, and I will follow up with the various agencies that are on this call. And I also just want to encourage every agency that is on this call to please utilize the Q&A feature as well as the chat feature. to answer some of the public's questions. Thank you.
Thank you, April. Hi, everyone. My name is Tanjila Rahman. I'm the Director of Community Affairs at the New York City Department of Consumer Worker Protection. I'm joined by my colleague, Alberto Roldan, who's the Deputy Director of Community Affairs at DCWP. I just wanted to thank Community Boards 9, 10, 11, and 12, and the Manhattan Borough President's Office for having us here today for this important reopening town hall. So in addition to what Miguelina covered at SBS, I just wanted to let everyone know that our agency, we have new educational resources for workers at nyc.gov/workers. We have information for workers as they transition to work under phase 1 and now phase 2. And so we have this material. We just published the phase 2 workers resource document on our website, and it has key, requirements for employees on what their employers must follow when they're reopening. And in addition to the small business hotline that SDS mentioned, our agency, we launched a worker protection hotline. So workers with reopening questions, they can call us at 311 or 212-436-0381. So workers can call us at 311 or 212-436-0381 and ask for the worker protection hotline. If they have any questions about reopening, health and safety guidelines for the workplace, or to report an employer that is not following the reopening requirements. So we want to make sure that it's, a smooth transition for businesses and workers. So, we encourage any employees that are covered under businesses for phase 1 and phase 2 to read our publication on some general and industry specific requirements that your employer must follow. So keep in mind, today is phase 2. So commercial building management, hair salons, barbershops, in-store retail, offices, outdoor dining, real estate, retail, rental, repair, cleaning, and vehicle sales and rentals are some of the businesses that can reopen in New York City under phase 2. And so we have a lot of information for employees, and we also have a FAQ, a frequently asked questions document for workers on just like the top frequently asked questions about like safety measures, face coverings, city and state workplace laws. And we also are working with community-based partners to educate our community members on phase 1 guidelines and resources for workers. And we're also doing a series of business education days. We're visiting businesses in neighborhoods that are hardest hit by COVID-19, as well as busy retail corridors, to educate workers and businesses about their rights and responsibilities during New York City's reopening. So for phase 1, we're doing a series of a couple of business education days. And we're going to continue along to do that for phase 2 as well, doing some business education days where we're going to be giving out the, reopening flyers, stay safe at work flyers, and then our phase 2 resource documents for workers that are also available on our website. As I mentioned, we have these educational resources for workers at nyc.gov/workers in multiple languages. We're going to get the phase 2 workers document translated. And, there's also other information about, other resources and local laws. And like I mentioned, people could call the worker hotline number. Thank you so much.
Fantastic. Thank you, Tangela. Up next, we have Jennifer with the Department of Transportation.
Thanks, April. Good evening, everyone. Can you all hear me okay? Gonna scoot on a little bit closer. Just to introduce myself, I'm Jennifer Santa Ynez. I'm the Manhattan Deputy Borough Commissioner at the City Department of Transportation. I want to thank Borough President Brewer and her staff and my colleagues at your office, as well as all of the community boards, for having myself and my colleagues here tonight. I'm joined by our Uptown Borough Planner, Lyle Blackwood, as well as our Borough Planner, Jackie Lazaro. So while I'm talking through some of our general updates on the Open Restaurants program, Jackie is going to share some of these links in the chat box just so that you have them handy and available. So as Miguelina mentioned, today was the first day of our Open Restaurants program. It's the city's initiative to provide additional space on the curb line as well as the sidewalk adjacent to ground floor restaurant establishments in an effort to just provide safe social distancing and outdoor dining. The first link that I want to point you to is the DOT Open Restaurants page. So that's nyc.gov/open restaurants. And that page has all of the different citing criteria as well as the general basic requirements for the program, including a link to apply to be an open restaurant. So this link went live on Friday, and as you would guess, we've had a lot of establishments that applied and are currently operating as an open restaurant. It's great to hear, and hoping for a successful first week, as we've had a really successful first day. In addition to the DOT Open Restaurants website and the application link, when you go to the website, there is also an FAQ page, which will help to kind of talk you through any additional questions that you might have, such as hours of operation, questions about different types of parking regulations and the roadbed, as well as other citing criteria that you might want to work through. So I'm happy to answer any questions. We've received many today from our colleagues, and I do want to mention that there will be a map that will be available on the Open Restaurants DOT page. We're aiming to publish that and make that live tomorrow, so that you will be able to kind of interact with your borough and see exactly who has applied and what restaurants are currently participating.
Fantastic. Thank you so much, Jennifer. And I just want to let everyone know, we're fielding some questions from Facebook. We do see those, as well as the questions in the chat and the Q&A. We are monitoring those, and I'm also sharing my email address on Facebook, so that if any of the questions that you all have tonight don't get answered, we'll follow up with the various agencies and get back to you guys, okay? So thank you to all three agencies who participated in this Businesses Reopening segment. Now we'll have Cicely Harris, Chair of Community Board 10, Central Harlem, moderate this Q&A session with SBS, DOT, and DCA.
Thank you, April. Good evening, everyone. Thank you so much for doing this. This is very important. I know the Uptown boards, we've worked together before, so I'm glad that we're continuing that. We need to do that more often. A lot of these issues do affect our downtown neighbors, but they always affect us just a little bit more. So we need to continue these conversations. So I thank you, Madam Borough President, for putting this together. DOT, SBS, and DCA, thank you all for being here today. Many of you all have been to our meetings, so we're excited to see you here again today. So I'm going to start out with Miguelina. Thank you so much for joining us. We have a few questions. These questions were submitted by community boards. How is SBS and the City of New York working to ensure that minority-owned businesses are ready to reopen successfully? And I just want to point out that there is a statistic that recently came out that 40% of Black-owned businesses are in decline right now. So that is one of the statistics that's out there. How do we reopen and make sure that these businesses are successful?
Sure. Thank you, Cicely, for the question. So I'm not sure if you know, but our new commissioner, Janelle Dorris, was the senior advisor at the mayor's office of MWBE. So he is particularly focused in making sure that minority-owned businesses have the resources they need to navigate the recovery and reopening process. So, you know, we know that those are the statistics out there, but the mayor did task the commissioner with saving as many small businesses as possible. And we know that 50% of the small businesses in New York City are owned by immigrants and minorities. So, you know, we have launched the resource hotline, the Restart Hotline. We have resources available in multiple languages. We have deployed plain language industry specific guides regarding city and state guidelines, regulations. So we want to always make sure that our small businesses have the most up-to-date information. We're hosting educational webinars. We're emailing and making sure that we work with our city agency partners to distribute the information. Working with our local partners, as I mentioned, we have over 70 community partners that rely on our information, and we rely also on them to make sure that they're talking to our small business community. So we have our interagency resource fairs, we have the phase 2 webinars, and all of this information, we're making sure that we specifically work with people on the ground. We're making sure that our minority-owned businesses have that information. And wherever we are missing the mark, please let us know. If you know that there's an organization out there that's not getting the information, please connect them with me. I will make sure that they are on our list. We have had partner calls, interagency meetings to make sure that we're getting the resources needed to our minority-owned businesses. You know, from there, we have distributed the PPE with a specific focus on our hardest hit zip codes throughout the city. As I mentioned, the commissioner has been going out during phase 1, that very first week. We're doing so again this week, and his goal is to make sure that he visits all the LMI communities within the city, again, to make sure that those constituents are connected to SBS, are connected to our chambers, our bids. And for those that are not on corridors that have chambers or bids, are connected to other partner organizations that work directly with us.
Thank you, Miguelina. Another question for you. How does SBS suggest that restaurants manage gatherings and other social distancing issues outside of their establishments?
Sure. So our guidance information is making sure that everyone knows that you have safety guidelines to abide by. Existing rules that obviously we know are mandated by the executive order of the governor's office. For instance, we have shared with our partners and through our social media channels and agencies the new governor's enforcement that came out on Friday, that you cannot have someone within 100 feet of your business with an open container. So we're making sure that our small businesses have the information they need in order to make sure that there's social distancing regulations that are being abided by, and other safety matters, so that we can all continue to go through the phases and kickstart the economy.
Okay. You mentioned Workforce One and all the work that you're doing with them. The unemployment surge has hit Manhattan, Uptown communities especially. What opportunities are now available for employment? Will there be any other city initiatives, and how are you connecting the folks that need work to these jobs?
Sure. So workforce is actually one of our priorities, also knowing that I think the statistics said that we have over 1 million people unemployed in New York City. Annually before the pandemic, the workforce division serves around 100,000 people. And we have people go through training. We connected people, New Yorkers, to over 27,000 jobs last year. But right now we have converted our trainings online to make it more accessible for people looking for training. One of the things that we also are doing is currently recruiting for the bilingual commercial driving training, the cable installation, commercial driver training, Made in New York post-production training. There's a couple of other trainings that we have available. For more information on that, you can go to nyc.gov/COVID-19 WF1.
One thing that might get people out into these businesses, into these restaurants, into these salons is proper cleaning procedures. With the introduction of phase 2 today, how will SBS make sure that these restaurants, salons, playgrounds, etc., are cleaning properly and disinfecting?
Again, I think that our guidance information that we're distributing with our partners are helping small businesses have that information. And that's one of our main priority, to make sure that small businesses, have the educational tools to make sure that their places of business are clean. And I don't have the guidance with me to share with you. Sorry, I don't have that, but we're making sure that the guidance are translated to the different languages so that everyone can have access to the information that they need. So again, our goal is to provide small businesses with the information so that they can continue to operate safely.
Okay, and will there be any enforcement behind these things, or would the guidelines have been provided and they're just going to do their own thing?
So SBS is not an enforcement agency. One of the things that we do is work with our sister agencies and making sure that small businesses have the information that they need in order for them not to be fined or taken through a process where they have to pay thousands of dollars in fines. So making sure that they have the best practices tips on their hand is what we do. Again, for those people that want to connect to our webinars and our guidance, they're free to do so on our website. At the very beginning of this pandemic, we started sharing, I believe it was like a 10-page guidance information on our page, and that then has become to be tweets and Instagram posts. And so working with our partners to make sure that they're also going on the ground and connecting with business owners so that they can have the information. So we're not an enforcement agency, but we're making sure that it doesn't come to that.
Hi, can I answer regarding the enforcement piece? This is Tangela from DCA.
Hi, Tangela.
Hi. I wasn't sure if I'm able to chime in regarding the enforcement. So businesses reopening requirements, inspections are going to be coordinated by the Mayor's Office of Special Enforcement, and they're going to be staffed by various agencies. So inspections will be conducted proactively to promote safety practices across the city, and will also be conducted in response to 311 complaints. So right now, the inspectors are focused on outreach and education to help businesses follow the guidelines, and will only take enforcement action in exceptional cases or persistent violations. So like I mentioned before, workers can call 311 to be connected to DCA with the hotline, worker protection hotline, with questions about if their employers are not following the New York State guidelines. And anyone can actually call 311. There's a portal, a 311 portal. It's the business reopening complaint portal. I'll link it in the chat box. So people, New Yorkers can file a complaint at 311, and they can, you know, like if they're having, if they have any questions or not sure if a business is complying with the New York State Department of Health guidelines. And, you know, every industry, they're required to follow specific guidelines, which include posting a safety plan where everyone can see it, giving employees free face coverings and PPE, and then providing, you know, maintaining hand hygiene stations, including like soap, water, paper towels, or contact-free hand sanitizer. And then also conducting like employee health screenings and making sure that there's frequent cleaning and disinfecting of any shared surfaces and posting signs and to show people where to stand. So they, you know, on the 311 portal, they can, you know, go to submit a complaint. As I mentioned, right now, we want to focus on outreach and education to help businesses follow these guidelines. And so, yeah, we could share that link in the chat box.
Thank you, thank you. I have a quick question on loans. Can you please address the minority-owned businesses, the concerns that they have about paying rent and paying that upcoming rent? Does SBS have any particular loans that they can recommend at this time?
So yes, right now, we definitely understand the pressures facing rent. We were glad to see that the governors extended the moratorium until August 20th, but we know that more needs to be done. So SBS has been at the table advocating our federal government to be able to think creatively about what they're going to do. We know that we need federal funding in order for the state and the city to be able to assist business owners with such a huge challenge. But at this moment, I would encourage folks to pay attention to the PPP, which was on the 6th, I believe it was on the 6th, PPP was extended, and now you can use up to 40% of the loan to pay for rent. At the very beginning, it was only 25, which we know that 25% of a loan offered by SBA was not going to work for small businesses here in New York City with the high cost of rent. So our federal delegation worked with the administration and the commissioner to make sure that our voices were heard. And that was one of the changes that was enacted early June. There's still over $130 billion left in PPP. So we would encourage folks to take a look at that and see if that would be an option for them. If not, we do have a list of 40 plus lenders, CDFI lenders that we work with, and we connect business owners to them. One of our experts will talk to folks looking for capital and then connect them to a CDFI. For those looking for that information, again, you can visit our page, nyc.gov/COVID-19 biz. And we actually have a list of the CDFI lenders and also the contact information to be able to speak to one of our business solution experts.
Great, thank you, Miguelina. Just because we're coming up on the 8 o'clock hour and we still have one presentation left, Cicely, I just wanted to make sure we got to some specific questions about hours of operation, music, and bathrooms, because we got a lot of questions about those from the public beforehand, so thank you.
Thank you, yes. Miguelina, if you wouldn't mind letting us know some of those general basic things. Is music permitted, and who enforces this?
Music permitted for small businesses or doing?
For the outside. If they're outside, the outside dining, can they have music at that point?
I would defer to my colleagues at DOT.
Okay, all right.
Yes, thanks,
Jennifer?
Cicely. Thanks, Miguelina. Of course, I'm happy to jump in. So just to clarify right now, our standard operating hours are Monday through Saturday, 8 a.m. to 11 p.m. and then on Sunday, 10 a.m. to 11 p.m. Right now, we are not allowing amplified music. So those, if there are noise complaints, we're asking that folks call 311 about any complaints, rather about open restaurants, just so that it's routed to the appropriate agency to handle. And there was one more part to that question, bathrooms, right?
Yes.
So DOT is not managing, facilities at this point. I'm not sure if Tangela or Miguelina want to step in.
Regarding, what was that, the bathrooms? What was the question?
Will bathrooms be open to patrons while they're doing the outdoor dining?
We could follow up on that. Maybe touch base with DOB, Department of Buildings. But yeah, we could follow up on that question. I imagine they should be, but I'm not sure. The business would have to maintain and properly, clean commonly used areas. So we can follow up with you on that. Yeah.
If I could have one more question for Jennifer. There's been a lot in the chat about enforcing of open streets. So how does DOT suggest that neighborhoods enforce the open streets? Because a lot of neighbors are moving the barriers and using the street as normal. So how is that enforcement happening?
Certainly. So Open Streets is a very community-driven and community-run program. So all of the requests that come in are either from community boards or partners that want to provide that assistance to open and close the street, but we're also receiving requests just from individuals who want to suggest a location for us to review. For any locations that are problematic, I think I did see some chat about 117th Street. We've heard about other locations across the Uptown boards. We're really leaning on our community partners to be good neighbors. So if someone needs to move the barrier to access the street or to leave in a parked vehicle and move a parked vehicle rather, we would hope that that neighbor would replace the barrier where they found it. If there are continued issues on any locations, we also try to reach out to the local precinct to see if they can, assist. But we're also looking for suggestions. I think for 117th Street, we have reached out to the 28th Precinct, but if there are suggestions on community partners that we could reach out to see if there's interest to maintain that open street, please send them over. Lyle Blackwood, our Northern Manhattan Borough Planner, shared his email in the chat. It's lblackwood@dot.nyc.gov, and we can certainly follow up with those partners as well.
Fantastic. Thank you so much, Jennifer. Thank you, Cicely. And thank you to all of the city agencies who participated tonight. We really appreciate you taking the time to speak with us. And as I keep mentioning, if there were certain questions that did not get answered, please send me an email or give me a call. Next up, we have Kevin Duffy-Greaves and Jerome Frierson from Manhattan Legal Services here to present on the housing concerns that are arising as the city continues to reopen. Kevin?
Actually, I'll get started. Hi, can you hear me?
Yep.
Okay, so my name is Jerome Frierson. I'm a supervising attorney at Manhattan Legal Services in the housing unit. I'm also an adjunct faculty member with New York Law School's Housing Rights Clinic. And I'm also a Harlem resident. And, we'd like to thank the Manhattan Borough President, Gail Brewer, for inviting us tonight. Please feel free to do so in the future. I'm here with Kevin Duffy-Greaves, who is the staff attorney in our housing unit as well. Just gonna get started off by talking a little bit about who we are. Manhattan Legal Services is the Manhattan Borough Office of Legal Services NYC. We have several practice areas to holistically address the needs of low-income communities of color. And with respect to housing, we are one of the legal services agencies that provides free attorneys to tenants facing eviction in New York City housing courts under the Universal Access to Counsel program. And so in the age of COVID-19 and the massive job loss that unfolded from it, The consequences of systemic racism in our country now lay bare, as all of the other panelists tonight have shared. A disproportionate share of the workers at risk of housing instability and non-payment are Black and Latinx, as evidenced by their overrepresentation in occupations that have faced higher rates of job loss. And without jobs, Black and Latinx members of our communities are at a significantly greater risk of eviction than their counterparts. So tonight our presentation will focus on how our attorneys intend to fight for low-income communities of color and what strategies we're engaged in to prevent and or manage the anticipated eviction surge, which we anticipate will be completely unprecedented. But tonight, please take note that we're only providing legal information and not legal advice. For legal advice, we ask you to call our hotline. And so with that, I'll turn it over to Kevin Duffy-Greaves.
Thanks, Jerome. So I'm going to try to fly through this so that we have some time for questions at the end. But what I've got up here, basically on what Jerome was just saying, there's a letter that we have here from our executive director at Legal Services NYC to the chief judge, asking them to halt the court reopening, the housing court reopening, for exactly the reason that Jerome was just talking about, that the coming wave of eviction filings are going to disproportionately hit our Black and brown neighbors who have just also been disproportionately affected by COVID-19, so it's a really brutal impact. So I've got a link to the letter there if you'd like to read more. So let's talk about some practical aspects of what the housing court reopening is looking like. First off, it's changing honestly daily. I had to update this presentation just a few hours ago because we're getting new information all the time. So today is the phase 1 reopening of courts, and I'm specifically going to be talking mostly just about housing court here. So technically they reopened to the public today, June 22nd. But if you went down there right now, what would happen is there's the clerks are sitting outside and asking people what it is that they're trying to do when they're coming into court. They're trying to make sure that only the most important issues are actually coming into the court in order to maintain social distancing rules. So right now, who can go in? Basically, if you're an unrepresented landlord, you can file new eviction cases right now. New eviction filings just restarted today as well. If you're a represented landlord, then your attorney would be the one filing that for you, and all other filings need to be done by mail right now. If you're a tenant, you might be able to go down to housing court to start like a case for emergency repairs. But I have numbers for you later in this presentation to look at. I would strongly recommend calling either Lisney, our office first, or calling the court directly and explaining their issue first. So what's happening? So yes, so new eviction filings can start today, unfortunately. So, but there's a lot of caveats to that. Landlords have to comply with a lot of new requirements if they're going to start with the eviction proceeding right now, at least as it pertains to non-payment of rent. Evictions for other reasons can probably proceed right now. The eviction moratorium, well, before we get to that. So what else is going on right now? So if you've got an ongoing case and you have an upcoming, and you're worried about having an upcoming court date that you haven't heard about, I just want everybody to not worry about the fact they're not taking any defaults right now. So what that means is, if for whatever reason you didn't get notice that you had an upcoming court date, no one's being penalized for that right now, neither side, landlord or tenant or attorney, whatever. There has to be, so you don't need to worry that something's going to be happening without you knowing at this point. New HP cases. So HP cases are cases that we can file to get repairs in your apartment. Before today, all you could do was ask for emergency repairs, so very severe issues such as lack of water or a broken toilet, stuff like that. Now, technically, if you have any kind of repair issue, you could file a case for it, but the court's been very clear that they're going to only prioritize still emergency issues, and first court dates are going to be very, very far away at this point. And in terms of how many new cases are going to be filed, Well, the court hasn't said that they're going to limit how many new cases can be filed. It's certain that the times are going to be very, very long, much longer than we're used to for first appearances on cases and subsequent appearances. But we can, at this point, expect tens of thousands of new eviction filings, frankly. So the specific question that we were asked today by the Manhattan Borough President's Office is, what can attorneys do to prevent a surge of eviction filings? Well, they're coming. There's nothing we can do to prevent the surge of eviction short of the powers that be reclosing the courts. But we do have a lot of new tools right now in order to defeat these new cases. For example, we've got Governor Cuomo's executive order that's in place right now. There's multiple executive orders in place. The eviction moratorium ended on June 20th, a couple of days ago, for many tenants. But there's still another executive order in place preventing evictions through August 20th for certain folks. Who are those folks? Right now, no new non-payment cases can be filed against tenants facing financial hardship due to COVID-19. And that's not on you as the tenants approve. In order to bring a case between now and August 20th, the landlord needs to have done some kind of reasonable investigation to show that you weren't financially impacted by COVID-19. What does that look like? Landlord comes to your door and asks, are you on unemployment? But they at least need to come and try to do that. We're anticipating we're going to see a lot of non-payment cases that are going to come in, and they're going to say something like, the landlord's going to say, I performed a reasonable investigation. To the best of my knowledge, this person wasn't affected by COVID-19 financially. That's not going to do it. That's not sufficient enough. And we're going to get cases like that dismissed. Did you ask the tenant? What dates did you go and try to visit the tenant? What did you ask them when you talked to them? So just be aware of that. And so, especially so in terms of the substance of it, if you have gone on unemployment because of since the pandemic started, you're definitely going to be covered by this. Beyond that, it's kind of an open question on what it means to be financially impacted by COVID-19. We could make an argument that anybody is, but certainly people who have gone on unemployment since the pandemic started are going to be covered. Beyond that, it's hard to say. Again, no new default judgments for anyone who doesn't appear at this point, and we don't know when that's going to change, but the courts are telling us for a while, don't worry about it. And for ongoing cases where there was already a judgment entered against someone, and they're waiting for a marshal either to issue a notice of eviction or to execute on a notice of eviction, there's going to be no enforcement of warrants against anyone who's been financially affected by COVID-19 through August 20th. So again, it's on the landlord to demonstrate that you're not. So that's a way that we have to defeat those and delay an eviction, at least. So can I be evicted during this period of quarantine? It depends. Basically, what I was just saying, the New York State moratorium, which is what we've been talking about, formally ended on June 20th. We've got the partial moratorium still going through August 20th for some folks. On top of this, there's also a federal eviction moratorium from the CARES Act. And this applies to certain tenancies. It's too complicated to go into exactly who's covered. Here's just a few broad strokes, if you might be. First of all, it's important to note it's set to expire at this point, July 25th, which is not very long from now. It only applies to filing of new cases. So if you haven't been able to pay your rent because since the pandemic started, that applies to you. But if you had a case going on before that, this doesn't apply to you. It also only applies to non-payment cases. If the landlord's trying to evict you for any other reason besides non-payment case, this doesn't apply to you. And then it only applies to buildings that are receiving federal financing. So definitely if you're a NYCHA tenant, definitely if you're in a HUD building, a Section 8, or if you have a Section 8 housing choice voucher, that's you. This would apply to you and you're covered by this moratorium. A little more difficult, maybe if your building is receiving a Fannie Mae or Freddie Mac backed mortgage, but that's pretty complicated. You should definitely contact an attorney about that, and we'll have a number for you to do that in a little bit. Okay, I have a pending case. Do I have to go to my court date? So no, still at this point, no one is required to do in-person appearances. And if you had a court date that was scheduled for like May 18th. Obviously, that didn't happen. When you get your new court date, you're going to get a postcard in the mail with your new court date on it. You can also check the eCourts website if you've got your index number, and you can check that every day and see if there's any updates, or you can always call the Manhattan Housing Court. The number's there, or the court has a special coronavirus line if you've got questions about your case. So just look out for a postcard if you've got an upcoming case. So again, that'll be sent to you by mail. If you have an attorney, your attorney is also going to be notified of it, so you can check in with them. And when will courts fully reopen? We have no idea. We only learned that they were partially reopening today, about 2 weeks ago. So we're learning, we don't have good answers for you, unfortunately, but clearly not during phase 2. If you want updates on opening, you can call 311, or I would highly recommend that Housing Court Answers number right there as well. And then this is a list of important phone numbers and contacts if you've got questions about housing issues. The big one at the top there, 917-661-4500. That's a great hotline. That's our organization. You can speak with an attorney Monday through Friday, 10 to 4. Yeah, so with that, I'll turn it over to Barry and Jerome for questions.
There we go. Thank you so much, Kevin and Jerome. One question that we do have is about for folks who have lost their income due to coronavirus. Understanding that they cannot have new non-payment actions brought against them until August 20th, has the city given any indication that they're going to be changing how they look at one-shot deals? A lot of the time for a one-shot deal, the city, requires you to demonstrate that you'll be able to pay your rent on an ongoing basis. Some people may not be able to prove that given the shutdown, and they may be restaurant workers out of work. How should people think about one-shot deals going forward?
Definitely. So in terms of one-shot deals, the city, to our knowledge, HRA has not given us any guidance about any change in their standards. So I think, as you mentioned, with a one-shot deal, it's rental assistance that's provided to a narrow category of tenants. People who can demonstrate, one, that they are facing eviction in housing court, and two, that they have an ability to pay ongoing rent. And so given our current circumstances, there are a lot of people who just simply are not going to be able to demonstrate either one of those things. And so, we actually think that short-term rental assistance, such as like a Section 8 program, for all New Yorkers who are facing financial burdens due to COVID-19. Some program like that needs to be initiated, because the one-shot deal program is just simply not going to kind of cover the needs of tenants facing eviction, or tenants who are impacted by COVID-19 financially. So we do regularly meet with Jordan Dressler, who is in charge of the office, who's in charge of like the HRA. He's an official at HRA who addresses with civil legal services providers, all of the changes that he's anticipating. One-shot deals was not one of them as yet. We do have a meeting with him this week. I believe the meeting is actually scheduled for tomorrow. He's going to give us some more updates, but that wasn't on the agenda.
Great. And another kind of related question is, if housing court is probably, again, there's a lot of uncertainty around this, and I want to acknowledge that before I ask this question. Things are changing quickly, but if housing court is going to be reopening in a limited basis, and there are probably going to be such a high volume of cases, what is that going to look like downtown if we have a flood of eviction cases being brought, but not a lot of courthouse capacity to process that?
Yeah, I can answer it. So this is guidance that we just got literally today, which is that service has to be done by mail, and tenants are not going to be expected to answer in person as they always have been in the past. They can answer cases by phone. And if they have some sort of technology issue, the court said that they're setting up computers at 111 Center Street for them to be able to do virtual appearances at the courthouse. We have no idea what that looks like yet or how they would let people know about it. But the answer to that is that they're going to do virtual appearances.
Got it. So the court is thinking about ways to increase the kind of throughput capacity as much as possible.
Yes. Yes.
Okay.
I mean, I just want to add like the caveat, you already acknowledged a lot of this is like a moving target. And so we don't have all of the answers. We just have information that is frequently changing. And so we did get a memo that was issued by the chief judge today, but it changes very frequently. So we don't have all of the answers. I mean, we just provided you with kind of information we got today, but it could change in the near future. So virtual court appearances will continue to happen for non-essential cases. Right now, housing court is still in phase 1, even though the city's in phase 2. Phase 2 for reopening for housing court is scheduled to happen on June 24th. And so, it's unclear what phase 2 will look like. But in phase 1, non-essential cases were only happening by virtual court appearances and not in person.
And so if I am a tenant who lost my job due to the shutdown, I worked at a restaurant, restaurant's closed, I lost my job, and I was unable to pay my rent as a result, what would be my first step right now before I get an eviction notice, or not an eviction notice, before I get a housing court notice from my landlord, knowing that I owe rent that I cannot pay back right now?
It depends on the circumstances, and we want to be clear that this is just legal information and not legal advice. It really depends on the particular circumstances. I think Kevin already shared some legal strategies that we immediately would be taking on behalf of tenants once they're in court, but I guess your question is about before even getting to court. Is that your question? Like what should they do before they find themselves in court? It depends. Like one thing they could think about doing is negotiating some kind of out of court settlement with their landlord. Like, I think to the extent that alternative dispute resolution is an option for tenants, and that would reduce the number of cases that we see filed in court. But but if someone just simply doesn't have the money, I don't see what kind of settlement negotiation they would be able to realistically engage in with the landlord. I mean, at some point they could ask, let's say the person's rent, the person's lease has expired, they could try to renegotiate a new lease in light of the fact that there's less demand for apartments. Landlord recovers possession of an apartment. It's not like they're going to be able to fill the vacancy easily. So that provides tenants, nowadays with more leverage than they would have for those kind of settlements. But I don't know if Kevin wanted to share anything.
I just wanted to add that, if in the particular situation you just described too, is I would strongly encourage that person also to apply for unemployment and also any benefits through HRA that they might be entitled to. And if you want assistance with the benefits, you can call that same number that Jerome posted, the 917 number for Lisney. If you apply for full benefits through HRA, you might be opening up new rental assistance options for your family down the road in a non-payment. So that would be a good thing to take care of now. So that would be another thing I'd add.
Got it. And can we talk about the role of counsel right now for a lot of people? I mean, it's not just the courts that have capacity limitations. It's also legal services organizations like MLS. So, and I know even with the right to counsel law, that happens when someone is in housing court, not necessarily in the lead up. Actually, let me preface that by saying, or by asking a question about what are landlords likely to be doing to prepare for their cases in anticipation of the August 20th expiration, or even now that the June 22nd date has passed. I know there was a question. I know there's a consideration that these cases may move faster because landlords may have had more time to pull together documentation and other matters that may, prior to the pandemic, have taken some time and multiple appearances in court to sort out.
It's difficult to speculate what landlords are planning to do in their cases. What I will say is I actually don't think that they have this kind of unique opportunity to accelerate cases in a way they didn't in the past. Like, Kevin presented on, there are a lot of ways that, attorneys the attorneys at my office can assist in slowing down the process. Like there's so many different technical defenses that we can raise now that, we have the the governor's executive order extending, the moratorium to August 20th for COVID-19 related cases. So, to the extent that a landlord tries to, file a case against a tenant in that situation without going through all of the proper channels, like Kevin described, we can get those cases dismissed. Similarly, if someone is living in public housing or has a Section 8 voucher, that person's tenancy will fall under the CARES Act, and there's a moratorium that is extended through July 25th for those tenants. So, to the extent that landlords are, trying to file cases immediately against people in those circumstances, those cases can be dismissed. So I don't know that landlords actually have a lot to work with, because there are a lot of laws and administrative and executive orders that are intended to reduce, the surge of evictions, at least in the near future. So,
one thing we have seen though is that landlords have been serving predicate notices, so rent demands and notices to cure, notices of termination during the moratorium, which is technically allowed because it's not the start of a case. A case is not started until a petition is filed. So so that's been freaking some callers out because they think that they're going through the process of an eviction during a moratorium. So that's just something to be aware that if you do get one of those predicate notices, doesn't mean that a case has started, it hasn't. It doesn't mean that a case will start. It just could at some point in the future.
Right.
And call Lizney about it too.
Right. So predicate notice is just an initial notice that an eviction case is pending or may soon be filed, but it has no teeth. So there's no actual threat of eviction at that stage. So.
And so that's really helpful because I'm sure a lot of people would be very scared about that. I know that we're short on time. We do have one question in the Q&A, which is how eviction or lack of payment may affect credit and the possibility of ending up on a landlord blacklist. Given this concern that's present even without a pandemic, how do we expect that this large influx of possible eviction claims or cases later in a month or so may affect tenants in future searches for housing?
So under the HSTPA, which is the new rent law, tenants should not be fearing the blacklist. The problem is that it's hard to enforce because landlords, just like everyone else, can publicly access information about eviction case filings. And so tenants who have cases filed against them, I wouldn't say they should be completely free of worry with respect to that, but the blacklist technically under the HSTPA should no longer exist, and there are penalties if landlords try to use them as a screening mechanism against tenants.
Excellent. And I did have one other question I wanted to raise that's a little bit, but since you brought up NYCHA, you know, income recertification is happening now, I believe with the July 1st deadline. And we've had a number of concerns raised from folks uptown that, especially for seniors and others lacking digital access, because management offices are not open or are open with significantly reduced capacity, folks may be having a harder time filing their recertification paperwork in order to meet that deadline. And so I guess a question for you would be, what are some steps that we as boards can take or other people in our community can take to help our neighbors who may be facing that difficulty?
That's a great question, and I think that that it's difficult because you know, I don't know what we can do to force the you know, these management companies to increase the number so that they can more quickly process the you know, these interim recertification applications. What I will say though is that tenants who are communicating with management companies are providing notice. They absolutely should be providing notice. That's, you know, their obligation as soon as they experience some kind of you know, income loss or reduction. They should absolutely, you know, take that first step of communicating with the management company. Get it in writing. That's what I would say, and you know, have it dated and signed, just to make sure that you know, to the extent that there's a delay, the adjustment in the rent can be retroactively applied. So I mean, we see a lot of retroactive applications, even, you know, pre-pandemic. We've dealt with those kind of issues, and so certainly post-pandemic, and you know, in light of what's going on. You know, I'm sure that tenants will be able to get retroactive recertifications for their rent.
Well, so actually we're getting a second follow-up on this question in the chat, which is, it's not just about for folks interim recertification to reflect a change in income, but just even the normal annual recertification for folks. You know, they may have questions and they'll try to call or email or write a letter, and they're not getting any response from NYCHA about their recertifications that they're required to do, pandemic or no. You know, have we heard anything from NYCHA about how they're going to be treating this issue for folks who fail to recertify by the deadline?
So I want to offer my office's hotline. Definitely call us, and we can investigate further for specific instances of, you know, of these issues. I haven't received any information from NYCHA or from Section 8. I'm not aware of any information about this. But I do think that tenants shouldn't be concerned, because once they've submitted the recertification or communicated with NYCHA or Section 8 about the need to recertify, then they've completed their obligation, and then, you know, kind of like the duty is then on NYCHA or the Section 8 or the housing provider to then process those applications. But again, I would direct folks to our hotline if they have questions about a specific case.
And Barry, as you know, we can handle a lot of the NYCHA. It's much harder with the private housing, but with the NYCHA, we can let them do something to those tenants. It's fun.
Excellent. Well, we know that the Borough President's office, and particularly the Uptown office with Rosalba and Athena, are fearsome warriors on the NYCHA front. I do have one more housing question in the Q&A, which was a question from a woman who had, I guess it looks like a ruling by a housing court judge ordering a landlord to make repairs, but the landlord never actually made the repairs and complied. How are tenants in that situation supposed to follow up, given the situation in housing court?
So again, this is legal information and not legal advice, so this is not specific to that person's concerns, but as a general rule, if a landlord breaches a court order, then the person can go back to court and ask the judge to enforce it. The landlord is technically in contempt of the order, and so by filing an order to show cause in court, then they can get the relief that they're seeking. They can have a court appearance on that issue. I think, yeah, as Kevin mentioned during his presentation, HP cases can be filed now, for repair issues. I guess this was already a pending HP case, or a pending case regarding repair issues, or maybe, so that person definitely, shouldn't say that person, but tenants in general can definitely seek relief in housing court now by filing a case, and if the conditions are serious, then the case will be prioritized. It'll be considered an emergency case, and so the person will definitely be able to be heard in housing court and get the relief they need.
Excellent. Well, thank you very much. I think those are all of the questions that I've seen asked, and the borough president's staff can correct me if I'm wrong or if I'm missing something from like a Facebook page, but documentation and documenting everything, as you said, is also probably a good procedure. But those are all the questions, I've seen. I thank, of course, Jerome and Kevin again for their answers, and April and Athena and Luisa and everyone at the borough president's staff, and the borough president herself for putting this together, because I know a lot of these questions have been going on and going around in our community, and it's very helpful to get us the information, and we can then take the information back and share it with our neighbors and our members of our community. So thank you.
Absolutely. Thank you so much, Barry. And thank you, Jerome and Kevin with Manhattan Legal Services. And before I turn it over to Athena and the borough president as we begin to close, I just want to thank all the community board chairs and the district managers who helped plan this forum and moderate tonight's discussion. It's really been incredible. And I also want to remind everyone that tonight's town hall was live streamed on the borough president's Facebook page, and we will also upload a recording of tonight's presentation onto the borough president's YouTube channel. So please take a look at that. And Athena, if you have anything to say.
Thanks so much, April. I'll keep it brief. It's been a long night. Just thank everybody for working with us in partnership. Thank you for your wonderful work as building our team and bringing us together. Also, I think there was a lot of helpful tips, resources, and contacts that were shared through the chat, and we hope that everyone will take advantage of those. And feel free to follow up with our Northern Manhattan office, who is also on the call, and we are regularly handling constituent issues and complaints every day. Thank you so much for tonight.
Great. Borough President Gail Brewer. Looks like you might be muted. Oh, wait, I think you're muted. Hold on a second.
Sorry. So I just want to congratulate everyone also, and to state that I'm on a ton of Zooms, and I don't think I've seen as many questions either in the Q&A or the chat or maybe on the Facebook as I have seen tonight. And you should know that people have stuck with this discussion. And I want to thank all of the speakers. I know you're tired. I know that you have a long day ahead of you tomorrow, and yet you stuck with this topic. And we will try to answer those that didn't get answered. But just thank you. This is a really helpful discussion. And these are questions that people have and don't often get answered. So thank you very much.
Thank you, everybody. And as I mentioned in the chat, if you have any follow-up questions, please feel free to reach out to the Northern Manhattan office, your community boards, your community liaisons who are on this call as well, Isabella Brayu and Natalie Espino, or email me directly or call me at 929-337-0978. Thank you all so much for attending tonight's town hall. Stay safe, stay strong, and have a wonderful rest of the week.
Thank you, April.
Thank you.
Thank you, everybody.
Thank you. Good night.
Thanks, everyone.
Thank you.
Good night.
Good night, everyone.